much. Hi, everybody. My name is Lisa Strube. Today, Laura, and Megan are presenting on the mind-body connection. I'm a sex therapist, and Megan and Laura are pelvic floor therapists. And we're so glad that all of you are here. Welcome.
So here is our presentation on the mind-body connection. We're hoping that us as physical therapists, we have some learning objectives that we will be able to, one, describe some physical anatomy that relates to sexuality. Two, identify barriers that as PTs or as occupational therapists, you can break down. Identify some mental barriers and where we can bridge the gap with you, Lisa. And then just talk about the physiology of arousal here. Okay, and just to introduce ourselves, I'm Megan, this is Laura. We are part of Kemper Pelvic Physio, and one of our big goals as a clinic is to really think about the whole body approach to sexuality and a sexual life. It's more than just the brain, it's more than just the body. We are kind of one full movement coming together. All right, so we'll kind of talk about just the physical aspect of it and just anatomy and what we treat as physical therapists. And even though we specialize in pelvic health, there's so much more that we look at outside of the pelvis. The very top being your diaphragm. That's the muscle that helps with breathing and inspiration. We have our back musculature, so everything kind of around the spine, abdominals, pelvic floor, and just your pelvic girdle muscles themselves, so your hip muscles. Even though we kind of categorize these into different areas, they all work together into our core system. And when one kind of aspect can go off or is not working as well, other areas tend to compensate. And that's why even if you're feeling symptoms within your pelvic floor, so if you have actual pain in your vagina area, it may be coming up from up the chain. You may not be breathing well, the ribs may not be expanding well, it may be stemming from some back pain, so that we'd like to take a full body approach with that. Okay, now more than just the musculoskeletal system, we also have your neuromuscular connection here, especially in the pudendal nerve, and that's kind of what's pictured on the very bottom picture there. It has three big branches to it. It innervates all of the pelvic floor. So if you're able to feel sensation around the opening of your front opening, your vagina, going back to your anus, that is the pudendal nerve. We also have nerves coming out from the back, again, why we look at your spine. That goes into many nerves, but the big ones we look at are genitofemoral and the ilioinguinal, because those can innervate the area and skin around the very front of your mons, the front of your labia, and all of those can connect into sort of the erogenous zones and have referral to different parts of your body. So whether that's nipples, ears, anywhere you kind of feel sensitivity. We like to also bring this up because the pudendal nerve itself is very unique in its anatomy. It has autonomic fiber connections, and that part of our nervous system is our fight or flight. And that's why mental health can be a really big importance to it, is that we just can't quite turn that off. If we do feel stress, any type of danger, our pelvic floor will automatically fire up. And that's why PT and mental health can go so beautifully together.
Sure. And so the other thing we want to talk about in terms of anatomy is that, we all have the same parts, they're just organized differently. And so you can see in that bottom picture, the structures that comprise a penis are actually the same homologous structures that comprise a clitoris. So you can see everybody has a glans. So that is that part in red. Everybody has a shaft, everybody has bulbs, and everybody has crura. And so only 10% of the clitoris is visible, 90% of the clitoris is buried. And we know from some really cool research into improving sensation for gender affirming phalloplasty, that there are actually 10,000 nerve endings in the glans clitoris, which is really amazing when you consider that in the glans penis, there's really only about 2,000 to 3,000. So that can potentially be a reason why, if you're going a little aggressive, just right at the button or maybe right on it with a vibrator that does not feel awesome, is because there's an overwhelming amount of nerve endings. And so you can really picture what that looks like if you look at that top picture, what it looks like in an unaroused state, and then what an aroused clitoris actually looks like. So again, if you can consider the more easily appreciable penis visually, thinking about the same amount of engorgement that we can have in clitoral tissues as well. And so we want to give enough time for that to happen, for comfortable insertion, for making sure you have a good time and are properly aroused. And your pelvic floor muscles are incredibly important for blood flow to the clitoral anatomy. So they actually lie straight over the top of the crura of the clitoris, as well as over the bulbs of the vestibule, which are partially responsible for blood flow and lubrication. And so we really want to make sure that those can move well. So that doesn't mean just contract and be very strong. That means we want it to be able to fully lengthen and fully contract so that the full range of motion of those muscles can not only help get blood into those tissues, but help maintain rigidity for the duration of your fun and playtime. And of course, your pelvic floor muscles also are really important for pleasure because they work together for different types of orgasms. So you can have an orgasm more from the superficial pelvic floor, from the deep pelvic floor, some kind of a combination, or even including orgasms that include vaginal, uterine, or cervical tissue. So lots of fun related to that. So we just want to touch on some of the physical barriers to pleasurable sexual activity that we see often in our practice. The primary one we see in our practice is pain. And I think when we look at the data from our practice, I think year over year, the most common thing that we see is pain with sex. So that's the most common reason people seek out our services. And so the pain that folks experience during sex could be insertional, meaning only when you try to insert either a partner, a finger, a toy, something like that. Or it could even be pain with external play. So if you maybe have some nerve sensitivities or things like that, that could be super painful. Or if you have a tissue sensitivity, that could also be painful. Other pain barriers to sexual activity include pain at rest. So there are some folks that will have pelvic or lower abdominal pain without any activity at all. And so obviously, if you're not feeling very good in that area, it's not going to make you want to engage sexually. So some of the tissue-related issues that we see include vulvar and vaginal dryness from things like genitourinary symptoms of menopause, or GSM. And now we actually have described a genitourinary symptoms of lactation as well. And essentially what that means is when you have relatively less estrogen in the system, we have less hydration in those tissues. It can feel and look dry and uncomfortable. And the same thing can also happen to trans men who are taking testosterone. So it really changes the way the tissues behave and how well they're hydrated. Other vulvar skin conditions, such as lichen sclerosis, can also contribute to pain. That is a particular skin condition that causes a fusing of the tissue of the clitoris, the labia, and potentially stenosing the entire vaginal opening. And it's very painful and can be limiting, but it goes in stages. So there's also something we can do to help folks manage that as we go along. Endometriosis is another huge factor for painful sexual activity. There's an enormous overlap in folks that have endometriosis and have painful sexual activity. So again, those could be folks that are having pain at rest, because endometriosis can be very painful at rest. Or it could be because of some of the connections in the abdominopelvic fascia, the pelvic floor, and the extra nerve deposits that come with endometrial deposits, that folks can end up having pain related to sex.
Alrighty, some actual physical barriers are just straight up physical barriers. So we see people who also just, it's really painful to lie on their back. If that's a position you formerly loved, that makes it quite difficult to actually engage in sexual activity. So whether it's low back pain, you may not also be able to actually open your legs wide enough to have a partner lay between your legs. So that is something we're going to see. It may not be directly pelvic pain, but it's within the pelvis itself that is hurting and limiting. In addition, arthritis. So let's say you would like to be on top. If your knees are hurting, again, that's quite limiting and something that PT can directly address. Now, someone who may be in a wheelchair or need walking aids, you may not be able to be on top if you want to, but there's many other different aids that we can help out with. So whether it's wedges, pillows, actually just kind of finding out what position feels good for you and what position are you able to get in and out of can be something that we can very well address with PT. Whether that's adding also in any grip assistance, so whether it's to the headboard, to the ceiling, to a wall that's next to a bed. We have our vibrators, which is going to be something we recommend to just anyone. You don't necessarily need a physical barrier for that. And then also leg strap-ons. So if you can't necessarily tolerate being on top, underneath, it can be something you can add on. Also, if your partner isn't necessarily able to maintain an erection for long enough, or if you just want additional partner play. The other thing that we can consider is those who have more chronic or persistent pain. So whether that's from fibromyalgia, EDS, POTS, where many different positions can be pretty difficult to tolerate, or long time can be difficult to tolerate. Actually, just cardiovascular endurance can be something we can address. Yeah. All right. Now, sensation, just physical sensation can change within the life cycle, especially as you go through menopause. The light touch versus vibration receptors will change, and one thing that maintains is going to be vibration over light touch receptors. So as you go through your life cycle, you might feel like it might be harder to achieve orgasm or to just feel pleasure with any type of sexual activity. And can be simply because your nerves are not quite as receptive as they once used to be. And that, if you had not already added a vibrator into your repertoire, that's gonna be a great time to bring it in. And that's not abnormal, and that doesn't mean you are less than because you need an assistance. It is a physiological change. In the same way that you might need eyeglasses when you grow older, you can also bring a vibrator in there. Okay. Now the opposite, where you feel too touched out, where it just everything feels hypersensitive, whether that can be something addressed by referring out to therapy. Also just stress management techniques are something we are happy to address with PT because those can calm the nervous system. And as we touched on earlier, if that stress is heightening your autonomic nervous system, yeah, pelvic floor probably won't be quite as receptive.
Sure. And the reality is our tastes and interests change. So we are dynamic beings living in a dynamic environment, and lots of different things can change over time. I mean, think about foods that you like. So those foods that you liked when you were a kid are not the same foods that you like now. And sometimes we go through phases where we really like one food, and then another time where we're like, I've had that too much, I want something else. And so the same is true for sexual activity with respect to sensation. We also want to be mindful of our folks that are neurodiverse or maybe have ADHD. So that can present several specific barriers to sexual activity. One of them is that it's kind of hard to maintain attention. So the ability to have different variety, whether that's a sensory input from some sensory play devices, so vibrators, impact things, different pressure, temperature, those things like that can be really helpful to bring attention back to the situation. And there can also just be sensory processing differences. And so it can be helpful for maybe a person who is overwhelmed with sensation to do some deprivation. So perhaps some earplugs or a face mask, so you can really pay attention to what's happening in your genital tissue. So there's lots of opportunities for playing, and that's something that we work on with our clients a lot, is trying to strategize and brainstorm about what might work best for you with respect to sensation. So what are some of the things that we do? And at the outset, we always say that every single person that comes to see us gets an individualized treatment. These are some broad general things of what we do. It's not like you will do all of these things were you to come to see us or another pelvic therapist. So we really try to treat the individual in front of us. So for folks who have insertional pain, we might use insertional trainers. And so we deliberately do not call those that D word. You might have heard dilators before. So I don't know about you, but dilation kind of sounds horrifying, and it's not really something I want to participate in. But instead, what we're doing with these devices is training not only your nervous system, but we are training your tissues to accept different objects and feel safe in the acceptance of those objects. So it's not like you're just sitting there and stretching. We want you to be an active participant with these devices. And so you can use trainers for the vaginal or front opening, or we also have anorectal trainers as well. Pelvic wands can also be helpful, and any of these can also vibrate as well. Manual therapy just means hands-on work, but again, we never have to do any hands-on work with anybody. I think also it is a myth that pelvic therapists, all we do is internal work. That is not true. Nobody ever has to have an internal exam ever, and I've even had clients that I never touch at all. I just instruct them in how to work with their own bodies, and that works great. Dry needling is something we do a fair amount in our practice, and it works really, really well for helping to calm specific peripheral nerves or specific muscles that have a hard time relaxing or aren't moving in the way that we want them to. When we're talking about external pain, so again, some of the things that we'll do there are manual therapy for some of those broader areas around the pelvis, really trying to think to where is the origin of that pain. So like Megan described, some of those nerves that are coming from the spine and going through the abdomen. Again, we're going to use dry needling for this and movement. So for all of our clients, even when we're talking about insertional pain, being actively present with the trainers is a form of body movement. So we know that in literature upon literature, movement is the #1 way to treat pelvic pain, any kind of pelvic pain. And so we teach our clients to move in ways that feel good and help to promote blood flow in the region, which is really helpful. Sexual aids, like we talked about, vibrators or other different devices, are also very helpful for external pain. Then, of course, there are those tissue issues that we talked about. So we help our clients try out and recommend different over-the-counter topicals or moisturizers. But really what we often do in many of these cases is help our clients triage with a prescribing provider to get topical estradiol cream, which is estrogen cream. It is an extremely low dose. We just had a lovely set of guidelines that came out last week from the American Urological Association, stating that this is standard of care and should be prescribed to all folks in lactation or in menopause who have genitourinary symptoms. And so it is eminently safe, even for people with estrogen sensitive breast cancer or ovarian cancers. Dry needling is also great for tissue issues. Again, all about that blood flow.
Yeah, and again, just to reiterate, blood flow is our #1 thing we are trying to get going. So whether it's arthritis, pain, movement is going to be the name of the game. Blood flow itself is just helpful. Our whole body loves them. It's why Theraguns are so popular. They add vibration, but blood flow comes to the area. Movement also is just helpful to desensitize pain in general, and just get you moving, as long as you can actually move the pelvic floor, even if it feels like you can't directly touch it. Research actually shows that it is good for not only strength, but stretch within the pelvic floor muscles. Now, one thing we can do, because we are all mostly sedentary throughout our day, is to help to open that whole body system. But not only is stretching supplemental for your parasympathetic nervous system, we want to strengthen to maintain that more open position. Okay. Desensitization. So if those nerves are unhappy, if you just feel, again, that touched out feeling, actually working with the tissue itself directly on your own or with us is helpful. So vibration, and doesn't have to be a vibrator itself. Again, Theragun, but there's some very specific tools we love to use. Then there's nervous system quieting techniques. I'm sure, Lisa, you will talk about those as well. But getting the vagus nerve, that sort of rest and digest king there, is going to be important. Just for this. But being able to right away access your vagus nerve, calming down the nervous system, especially if you feel that sudden onset of pain when you're going towards your pelvis. And then one thing we kind of see, especially within our first exam, is some people might flinch away before we even touch anything. And that's because the anticipation of pain can be almost more powerful than the actual trigger within your body. So that is also where vaginal or insertional trainers come in very handy, as they bring the autonomy to the person we're treating. But then it kind of helps to observe that dichotomy versus what you're anticipating versus what does it actually feel like within your body. So if we can retrain the body to say, oh, actually, this doesn't really hurt, you're gonna have less of that anticipatory guarding and less of that pain. And then lastly, just that supportive guidance. Do we need some pillows, some actual support bolsters? Can you tolerate different sensations by yourself? And then can you tolerate them with a partner or partners? And then just thinking about how do we broaden your sexual menu? Does it just have to be PIV? Can we bring in more outer course or some foreplay external touching for good sensations beforehand? Does it just need to be, again, clitoral? Are you open to any like rectal sensations? Just different types of sensation can be life-changing here.
Yeah, and so even though we always like to collaborate with sex therapists and other mental health providers, there are some things that we address as therapists. So we treat from a trauma-informed and psychosocially informed approach, and I'm also a sex counselor, and so I have additional training in specific holistic counseling approaches. And so some of the things that we see around that we do treat with our clients are, teaching them to work with the different phases of the sympathetic nervous system related to arousal. So if you have a vulva, some sympathetic nervous system activity is actually helpful for arousal, but if it's too much, like if you're anxious, nervous, or scared, that's going to be dampening and difficult to be properly aroused. And we want to be mindful of that relationship between acute and chronic stress, which, as Megan mentioned with the pudendal nerve, is very affected. The pelvic floor is very affected by any kind of stress. And so we want to talk about ways to manage that in order to work with that. And recall that because there's a little bit of sympathetic nervous system activity is good for arousal, and orgasms and any kind of squirting or ejaculatory anything happens on the sympathetic nervous system, we can actually have multiple orgasms if we learn to harness that properly. We also want to talk about what's called the dual control model, or brakes and accelerators. So in order to have the type of arousal we might want, so what we're looking for is to be able to take down the things that put a brake or a damper on that and try to amp up some of the things that get you going. So we're trying to figure out what those are for folks so we can get a good balance of that. And we've talked a ton about blood flow, and we try to educate our clients in helping them to recognize what those things feel like in their bodies, so they might know when they've achieved, actual swelling in some of those tissues, an increased temperature and heart rate and respiratory rate, actual tenting in the vaginal canal, and self-lubrication, even though you should always use lube. But self-lubrication is actually non-concordant for how aroused you feel. But we teach our clients to try to recognize those things so they can set themselves up for better success when they're having something inserted. And so just as a ballpark, and you can maybe pop it in the chat if you want to, how much time do you think on average is required for comfortable insertion? Just ballpark it for me. 5 minutes, 10 minutes, 45, what are we thinking? Anybody want to be brave? 20, okay, good guess. Anybody else? Okay. Anybody? Okay, so the answer is 20 to 30 minutes. 20 to 30 minutes is the average. And so if you are spending 5 minutes on a little bit of kissing and then trying to get it on, that is not going to feel awesome for you. So it's longer than you think.
At least a few songs.
Yeah. All right.
Yeah. And just to kind of reiterate this, pelvic floor muscle training itself to get blood flow, and we kind of think about pelvic floor muscle training, you may have heard of Kegels, just kind of getting a contract and relax. Same way, you may have heard of like a muscle pump in the arms after the gym. Pelvic floor muscles respond the same way. Just general cardiovascular exercise is an excellent way to get blood flow going. This hasn't really, I think, been researched in clitoral tissue, but in just penile tissue, actually having cardiovascular endurance is important for erectile function. Same thing within the clitoral and vulvar. Dry needling, again, can't reiterate enough how much we love it in our practice because of how much it's helpful to let the muscles relax, but move and get blood flow going directly to the tissue we'd like it in. And then vibration. So everyone should have a vibrator at home. They have sympathetic nervous system getting some pre-sex movement, and that does not necessarily need to include, again, outer course or foreplay, actually going for a walk ahead of time is still very effective. Gets a good warm up going. We like to have some exercises that we prescribe to people. Having that transition time, whether it's, if you're taking care of the kids the whole day, yeah, you might want a little moment to yourself to actually kind of turn on that romantic side of yourself, whether it's solo play or with a partner. Using environmental cues. So what Laura mentioned earlier, are you kind of noticing within your own body, noticing within your partner too, or partners, and then being able to manage pain itself. So if you're in pain, that doesn't necessarily turn up the arousal. So can we turn down the pain in your body? And that can be just from movement, stretches, but also from that nervous system downregulation. Brakes and accelerators, those are good things to list out for yourself. What turns you on? And those can be like, wow, my partner did the dishes and I really love that. Okay. But also what turns you off? Like, wow, my partner did not do the dishes. That is something, and it doesn't have to be big. It can be the sheets are dirty. Let's change those. Put the sheets in the washer, pop some new ones on, make an environment for yourself that feels sexy and that you can sort of set yourself up for success. And then just communication. So actually writing them out and being able to verbalize that within yourself or with the partner is going to be important.
All right. So I am presenting on the mental health part of the mind and body connection. But first, I want to say not only is the mind body connection good for a better sex life, but it's also good for moments of peace during distress. It's also good to give yourself what you need, like listen to music and rest. This is an empowering topic that can help you have a healthier and happier life because your mind and body is always speaking to you. In addition, why does this matter? Understanding the mind-body connection can lead to more compassion, pleasure, and love every day. Having more of these things can improve the relationships with yourself and others. As you see, these pictures on my slides have meanings. They have purpose. And all these hearts mean that I encourage you to give as much love to yourself as you do to the people you care about. And I know that you give so much love to all those people that you care about. So on our journey together, we are going to talk about who is Lisa Strube. It's nice to meet you. We are going to make peace with your pause button, the reasons why you don't want to have sex. We're going to talk about the power of your brain. We are going to get you to listen to your body more and explore your turn-offs and turn-ons, gently and kindly, please. Then we are going to bridge your body and mind and talk about the gift of presence. I have 2 exercises planned, but I'm not sure if we are going to be able to do both of them. And I like these little animals here because they're friendly. This is a friendly presentation. All are welcome. So here I am. Who is Lisa Strube? Oh, right there. It's a pleasure to meet you. I know I said that twice. This is me. I got my friend to draw this picture. And I wanted him to draw this prosthetic here because I got hit by a car when I was 18. It was life-changing. It changed the trajectory of my life. I feel it has given me a lot of resilience and insight these past 20-odd years since it's happened. Let me go over here to the world and the book and the mind that blossoms. I'm a lifelong learner who loves to learn from books or other people's experiences, and it's deepened my perspective as well as contributed to my revolution, something transformational. I'm a mom and I've never felt such love for a person before. It's incredible. And here's me, I love to sing and dance. I have a passionate, fun-loving side. All these things contribute to my love of being a therapist. There's nothing better than helping someone connect with others or themselves and helping them get to a better place. So that's enough about me. Let's understand the pause button. Okay. So get ready because something's coming up and it might cause a reaction inside of you. So, and I want some comments in the chat if it does, if you feel comfortable enough. Okay, these are the reasons why you don't want to have sex, because it's too much. Everything is too much. But so if you are feeling like it's too much every day, or once or twice or a few times a day, then that completely makes sense as to why you do not want to have sex. And let's go into the reasons why you may not want to have sex. Let's say this is you. All these reasons may not apply to you, but even one of these reasons can make a big difference. Let's go into aging parents. That could be a lot. A lot of times women are automatically assumed to be caregivers. It's pressure and also it's draining with all the other responsibilities that we have. Here is work, and work is not an easy place for a lot of women. A lot of times there are so many demands and we continually have to prove ourselves. Much more, we don't get paid as much as our male counterparts. And there's also the feeling of not being appreciated or feeling like we don't matter. There's layers of complexity and stress in that situation as well. And so here's family, and family can look like whatever it looks like. There's so many definitions of it. And I had to include the fur babies because a lot of times they're the only ones that understand and don't judge. So women are the heart of the home, and we calm the storms and we meet everyone's needs before they're spoken. Sounds pretty magical, but it's pretty hard and it's pretty draining. Things will break down without us. So what's left? Our relationships. Unfortunately, they get the leftovers. And at times, women may get blamed for not wanting to have sex. But look at all the reasons that are draining you and keeping you tired and stressed out. I've talked to so many providers who say it's the norm that women are overstressed and not getting the help they need. But that's just not a good reason. Even though it's normal, it shouldn't be happening like this. So I'll hopefully allow you to give you some grace as to why you're tired all the time and not wanting to have sex. But there are more things to consider that are impacting your brain. Wait, that affects sex too? And here is a group of women. I would try to be as diverse and inclusive as possible. All of these 4 things I'm going to mention, it's a deep dive. I encourage you to explore all of these things. I have a Substack that I'm going to start sending out. If you explore these things, it's probably going to piss you off, but you're going to be more informed and understanding as to why things are the way they are. Looking at culture, many cultures you're not allowed to talk about sex. And so when you have sex for the first time, there's performance anxiety, shame, fear. A lot of times you avoid sex afterwards if you don't deal with it. That's a powerful message to have. If we look at movies and media, think about the last movie that you watched, probably had thin, attractive people, and the sex was performative and not connecting. There are these unrealistic expectations that we have to meet. Another message to our brain. Here's religion. The thing I want to focus on is purity culture, because for so long, women's value has been tied to sexual innocence. And I've seen that damage so many people. I want to add this in that Faulkner wrote, virginity was a man's invention. Just for fun, just wanted to add that in. Last thing I want to address is trauma. Your brain might want to have sex, but your body might still be living through something painful, and sex will be very difficult if this is happening. So one or all, or however many combination of these things can make your brain not want to have sex. And when your brain doesn't want to have sex and is overwhelmed all the time, guess what? No brain, no bang. Your brain is the most powerful sex organ. And if it doesn't feel aroused, if it doesn't feel safe or connected, then you're not going to have sex. And if there is no arousal in the brain, that is going to be a problem because sexual arousal begins in the brain. Let me go over here. Okay. If your brain is not engaged, then it's not possible to have a fulfilling sexual experience. The brain has to say yes before the mind can follow. Now let's go into how the body joins the brain. I'm going to interchange brain and mind. I should have told you that earlier. Your body is always speaking. If your brain is aroused, your body can follow with warmth, heightened sensitivity, or increased heart rate. Look how peaceful she looks. I would love to look peaceful like that all day. If your brain feels shut down or overwhelmed, your body will follow with fight or flight. If you experience connection, then your body will soften. But if you're not feeling safe, your body will tighten. So your body is always speaking to you. All you need to do is listen to really understand what's going on with you. And just know that arousal starts with safety. So we're going to bring the body and mind together, and they need to be aligned for sexual experiences. This is where the dual control cycle comes in. And Megan and Laura talked a little bit about this, but I'm going to go a little deeper and tell you that the brain has two systems, the accelerators and the brakes. So the things that turn you on, as mentioned, like smell, touch, taste, connection, safety. If your brain gets turned on, then your body will respond with that warmth, increased heart rate, sensitivity. Your body's aligned, you're ready to go. But if your brain feels the brakes, like the dishes, or even just stress or an argument with your spouse, your body will respond with just shut down or fight or flight. I want you to explore yourselves. What are your brakes and what are your accelerators? And sometimes people have more sensitive accelerators or more sensitive brakes. It's a combination of things. I want to mention sometimes too, it might not be what the accelerator is. It might be what's pressing your brake all the way to the floor. So what can you do to get that brake up? Your mind might be aroused by something you're watching on Netflix, but your body might feel overwhelmed and exhausted from emotion. Or your body might be turned on, but your mind might be overwhelmed. That's very, very common. And that we could do something about that. But now, as you have been thinking about your accelerators and your brakes, I want you to do a poll with me. Name one accelerator and one of your brakes. Okay, over here. So is it closeness with your significant other? Like, how about how you view yourself in the morning? Or view yourself at all? I mean, I find dirty dishes absolutely not sexy, but maybe some people do. So anybody want to respond? And the more funny or unusual, you get bonus points. Anybody?
And then someone else just put in the chat for breaks, like laundry, cigarettes, and alcohol too.
Oh,
And someone else just threw in the chat too for breaks, doom scrolling.
Doom scrolling. Why is no one putting accelerators down? Everybody out there? No one has accelerators?
We just had one that said accelerator is dancing.
Oh, I love to dance. Oh, fun thing to do.
We had another accelerator is laughing.
It's laughing. Perfect. All right. So I just want you to notice how much power you have already into knowing what your brakes are and what your accelerators are. Like you can do that all day long. We could do this forever. And I want you to have fun with it. And here is some inspiration. I know this is not everybody's job. I try to be as inclusive as possible, but whoever you find attractive, just imagine them not wearing any clothes and doing that dirty dishes. Just imagine that, or have fun. The most important thing about sex and intimacy is having fun and laughing. And so get creative with your accelerators and be honest about your breaks. All right, that was fun. So when your body is disconnected, the mind and body, or you just feel stressed out as a whole, mindfulness is that bridge that allows the body to speak to the mind and truly listen. I like this graphic because I wish I could be like, all relaxed and have butterflies around me all day too. Please feel free if you want to participate. And if not, you could sit this one out. This is a body scan that can help with low desire, low arousal. Oh, all right. So let's all slow down, or anybody who wants to, just for a moment, and sit or lie down comfortably and close your eyes if you'd like. Take a deep breath. Notice your feet. How do they feel? Warm, cold, tingly, tired? Slowly move up your body, legs, belly, chest, arms, face. Don't judge, just notice. If you feel tension, breathe into it. Let it soften. End by bringing your attention back to your breath. Inhale, exhale, that's it. This helps you feel your body again without judgment. It's a way back to the presence. Okay. All right, everybody. And do it as oftentimes as you like. It's to help you become aware of what's in the body and work through anxiety if you struggle with that during sex. And you can also use this outside of sex. And now we are going to talk about the gift of presence. And I want to say it's really important because presence is one aspect of having amazing sex. I totally encourage you to use presence any moment you can, whether it's with your kiddo or with your partners or just smelling flowers. It helps you savor the amazing moments of your life and really live. That's important. That's how important presence is. And the more you practice mindfulness and be present, sex becomes so much better and so much more connected, and you can really live the experience. Because if you're completely present, then you completely feel everything that's going on. I like to feel presence when I walk out the door and the sun is on my face, or slow mornings with my family. Words of guidance. It's okay to say no when you don't want to have sex. It's a way to honor your body. If you do have sex and you don't want to, it just adds to resentment for yourself and your partner. And when you have sex because it comes from an honest, loving place, that's when it'll feel good. Intimacy does not always have to be sex. What does safety and connection look like to you? Listening to music while you're cooking dinner, holding hands while you're sitting on the couch. The options are endless. And intimacy is most enjoyed when relaxed and present. So to get relaxed and present, all you got to do is take a minute, slow down, and breathe in and out. And if you delve into mindfulness, there are so many tools. It could be a whole new world for you. And you could just take a couple minutes a day. It's life-changing. Closing time, own your power. Everybody out there, your body and mind is speaking to you. And the reason why I did this presentation is for women to have power and pleasure. That all comes from knowing about your body-mind connection. Because if you listen to it as much as possible, then you could take just awesome care of yourself and have amazing sex lives with yourself and your partner. You can live your best life because your body and your mind never lie to you. Unless you're making it. So, and that's another thing. But yeah. I wish I was this person too, just relaxing every day. Love hammocks. Thank you. And here are some resources that I used. And here's me with my Don't Talk to Me Till I Have My Orgasm mug and my clitoris scarf.
So if there's anybody who has any questions, we would be so happy to answer anything either directed for myself and Megan or for Lisa, if anybody has anything they'd like to know further. So we had a question in the chat wondering if we can explain dry needling. Happy to. So if you've ever heard of acupuncture, dry needling is a musculoskeletal form of acupuncture. So we use the same type of very small, very thin, solid needle. So it's called dry needling because unlike an injection you might get where you're getting a vaccine or something like that where something's going through, there's nothing actually coming through the needle. And so what we use dry needling for in our practice is two main reasons. One is to address a specifically tender point in a muscle. So we're finding that tender point, placing the needle in it, and then we use electrical stimulation, a low frequency electrical stim to help bring blood flow to that muscle, promote relaxation, things like that. And the other thing that we can do through that process is approximate some of those peripheral nerves that might be firing too much or maybe firing too little. And through that same stim process, we can encourage some of those nerves to fire in a more normal way that can help either reduce pain, improve function, some combination of those things. And we dry needle from head to toe. We do a lot of dry needling within the pelvic floor, the abdomen, back, hips, even into the neck, things like that. So it's a great way to get a whole body down regulation as well, because it feels pretty great for most people. For some people it doesn't. So it's just one of the tools in our toolbox. Anything else?
And it's also very useful if actually digital insertion or any type of like insertion within the vaginal canal is really painful. We can still directly address the pelvic floor muscles and the tissue with dry needling. So it can be often way more tolerable than any internal work. And then also if that's kind of a no-go zone for you, that's another option. Yeah. Okay. We have a question. What exactly or what to expect with pelvic floor muscle training? Okay. So that is kind of a big umbrella term for us. And it can be really different from person to person. So some people do actually kind of think about it as just Kegels, but it can be sort of a contract and then a fully relax. So a lot of times we see pain with sometimes just a little bit too much tension or a guarding response of the pelvic floor muscles. So sometimes muscle training is actually training them to relax and lengthen and be able to accept any type of insertion. Sometimes it is actually creating tension within the pelvic floor, like just kind of creating and solidifying that connection from your brain to your body. Now, pelvic floor muscle training explicitly is within the pelvic floor, but is also not all we do. We like to do a lot of outside exercise. We have a full gym, and we recommend not just us, any pelvic floor therapist you see does do some work outside of the room and does some exercise all over, because it's more than just in the pelvis there.
And so for what it's worth, we also see all genders of folks in our practice too. A large percentage of our clients are also cisgender men, and we see trans and gender expansive folks quite a bit in our practice as well. And as a sex counselor, I also do help individuals, couples, and polycules.
I think that's it. And we're happy to answer questions individually as well. Feel free, you can email Lisa, you can email us at info@kemperpt.com. Happy to answer all of those. And thanks for everyone for coming out.